Hi, my name is Miriam Guerrero. I work for Azalea Health. My position in this center is to be Community Outreach Coordinator. Usually I have a program for the migrant outreach community called Mensajero de Salud, which in English it translates to Health Messengers. They are independent contractors who are trained every month to learn about a different chronic illness and to go in the community and teach how to prevent this type of chronic illnesses, such as diabetes, high blood pressure, high cholesterol, etc. I think there are many different factors that help impede having a good health within the community. I think the primary issue is money. A lot of people cannot afford to go to a doctor, a private doctor, or even sometimes centers as we that have a sliding scale fee. The other one is health insurance. Many lack health insurance. They can't also afford to pay it. But overall, I think education, the importance of learning how to take care of themselves and how to prevent illnesses, which are sometimes hereditary, but they can help it, prolong a little bit more the chronic illnesses. There have been many within this Panam. Panam County has helped with a couple trainings, like nutritionists offering how to change your way of eating, healthy lifestyle changes. And also part of the program we have what talks about how to prevent chronic illnesses from arising within the community, making changes in our foods and substituting one thing for another just to make small changes. Well, most of it's the doctors. The doctors are the ones who, when they go to consultation, they get their lab work done, and also us, we give information out, trying to help them control or prevent illnesses. And also there's a lot of nutritionists out there who help. There's also different type of programs that just help with educational materials. Well, most about, I go back again, education is very important. Teaching the community how to take care of themselves, how to prevent from having high blood pressure, as consuming less sodium, and diabetes, consuming less sugary stuff. But the most factors that I find in the migrant community, it's diabetes, high blood pressure, high cholesterol, asthma in children, and what's the other one? I mean, there's different ones, but mostly, like I said, it's hypertension, diabetes, and high cholesterol. I think doctors should spend a little bit more time explaining to the patient the illness, and also that medication it will help control the levels of whatever illness they have, but to spend the time telling them that the medication does not really tell them, you can go and eat whatever you want. You have to control the way you eat. Most of it's healthy lifestyle changes with the diet foods. Having more gyms in a more where everybody can afford to go, because sometimes it can get a little bit more expensive. Having more activities in the community that involve having a 5K walk, also having farmers produce with more fresh ingredients, because I know fruits and vegetables are sometimes in the expensive side. But just overall, having different changes, physical activities within the community. Usually we have health fairs. Like right now I'm organizing one for the migrant community that will be on July 27th. And we will have their different educational materials. We will have screenings for diabetes, cholesterol, blood pressure, and vision. So there are sometimes good health fairs out there within Panam County. Of course, Panam County is a broad area, which sometimes it can be in Palaca. This is the second time I will be organizing a health fair in Crescent City. But there's not really much health fairs or community involvement to make a different lifestyle change.
I'm Dr. Francisco Martinez Whittingham. I work here at Azalea Health. I'm a family physician and board certified. Well, there are several things. The main one I will say is education. Many people are not educated about how the body works, what is important on their health, nutrition, and that leads to obesity, diabetes, and hypertension. Okay, yes, there have been a few programs. One of them is we have the PAP clinic, which is a very inexpensive service that we provide with PAP smears for the community, and it has increased the awareness on the endometrial cancer, and it's been a good experience. Now, the other thing is that the Rotary Club has every year in February is a program in which they provide blood work screening, and patients just go there, it is a low-cost exam, and then they provide the results either to the physicians or to the patients, so they can bring it to a doctor. And through them, with this, patients have discovered they have diabetes or high cholesterol, and then they reach out for help. The patients.
The patients?
Yes.
Can you expand on that?
Well, there is the common thought that we should provide all the things for the patients. But I think we should provide the education, but the main responsibility should be imprinted on the patient. Many of our patients, they know they have diabetes. They know they need to lose weight. They know that what they eat is wrong, and we keep saying that to them. But they don't take the responsibility. They want us as providers to fix them. And that cannot happen. We cannot fix anybody. It has to come from within. If the person wants to change, then they will change. You can give as much insulin as you can, but if the patient keeps waking up in the middle of the night to eat ice cream, and then when he checks the blood sugar in the morning, it's not gonna be 130. It's gonna be in the 200s. That is beyond our control. So yes, in our part, we need to provide education, but the main responsibility should come from the patient. Okay, yes, we do have a big problem with compliance. The way we address it is, well, during the visits, we provide education to the patients on what would be the consequences of not following the directions. But as you all know, many of these problems have to do with habits. And habits are stronger than knowledge. Many people, many of you, even physicians, smoke. Even though you know it's bad for you, you still smoke. So knowledge is not the only answer. That is habits. We try to address that in the visits, tell them how they can change their habits to do a better, to have a better outcome. But it's a difficult question to answer. I don't think that anybody knows or has the magic bullet yet, because otherwise people will be changing, and it's really hard to change. Yes, I don't know exactly what types of programs or classes they teach in school, but I'm certain that when I ask the patients what do they think about viruses, what is a virus, what is a bacteria, do they know? They don't know. They don't know, even though they've been going through high school, and I would expect that if you're in high school, you should know a little bit of basic health, like what can attack your health, like viruses and bacteria. So yes, it should be implemented there. But if you look a little bit further, it should start at home. It now becomes a vicious cycle, because who teaches the parents? Who's gonna, it has to start somewhere. So I guess school will be a good place to start. At least when these children become parents, they can teach their children. Yes, well, we do have we do have an implementation here that we look at the BMI of children. That's where we should start, and then before they develop diabetes, before they develop high blood pressure, we've been sending them to the nutritionist, trying to get nutritionist programs around here, which is really hard in this rural area. And so that's the plan. We need to catch them before they happen. we've had some success, but there's a lot to be done, because the problem is, even though they know it is happening, they don't have the will to change it yet. Well, that is a tricky question, because how can we change behavior? So it goes back to the habits question. The first thing is you have to acknowledge that you're not having a good behavior. So the first point will be for us to make sure that people understand what is the problem, where is it starting. And again, this is deeper than that. It has to be by individual. Every individual has a different habit that they need to break. So I think in the future we should focus more on habits, psychology of addiction, including food, sugar addiction, soda addiction, all those things that are causing our chronic diseases, and take that into consideration. Maybe have the health insurance cover those counseling sessions, so probably to be more successful. In this particular community, if we had access to a nutritionist, that we could set up meetings in the school or workshops, that would really help. And by workshops, I mean also explaining them how to shop, how to prepare the foods that they already prepared, but in a healthier manner. See, it is hard to change people, but you can modify things that people already do into a healthier way, and that could be more productive. But we don't have access to a nutritionist around here. It's within the plans of our company to in the future be able to have one, but there is not much access to one at this time. Yeah, so as I said before, the Rotary Club health fair. There are health fairs that are hosted by the hospital and by the different clinics, not only ours but all other clinics in the area. We do have an outreach department, which they go out into the community, try to teach, especially the younger population. Is geared towards children and young families. Those are a few of the things that we do, or that they are available for them.
All right, thank you.
You're welcome. Thank you.
Definitely the socioeconomic aspect. That is the primary. They don't have any money. They're very non-compliant because of it, so that impedes their health care considerably if they can't afford the medicine. There is a South Putnam Christian Society that will help some people. The drug companies provide wonderful help for patients that can't afford it. It's called the Independent Drug Program that Dora does for patients. We do have samples. Yeah, there's all kind of different ways to help. Predominantly around here, I would say COPD and diabetes are the two worst things we see. They employ the clinic because they have interns and med students. They did have a diabetes clinic in the Palatka office. Here we do not. Where there's no awareness programs for major diseases. And definitely the healthcare community. The government, of course, is going to have to supply the money, but I think the hospitals should take more of an active role in preventing it. We do a very good job in diagnosing and referrals if they're chronic. Yeah, with education, but we don't have that process at Family Medical. I don't know if there's money available for such a thing, and I don't know of anybody in a rural setting that could really take it over without the money or funding. So it's a problem not being able to take care of those major disease states. It's got to be education and awareness, and I don't know how they're going to do it. compliance is my biggest issue as a pharmacist. People will go 30, 60, 80 days without their meds because they can't afford it. They don't understand the bad things about their disease states. So the education and awareness is hard to get across sometimes.
As a pharmacist, do you provide counseling to your patients about the drugs that they're taking?
Absolutely. Yeah, I sure do.
So you'll sit with them and talk about like what each drug is for and
How important it is to take it, not to go without it. Yes. And it's just compliance and awareness, you know, and money. The socioeconomic state of places like this is a real drawback to their health. The Rotary Club in Palatka does a blood screening twice a year, which is very helpful because it's very nominal fee for some of the blood tests. And they occasionally will have a health fair, like at the mall or in Crescent City at the Women's Club. I just don't know if they do enough. And people are lazy. You know, they think they go to the doctor one time and they're fixed. So they don't follow up with their health care.
My name is Sally Jackson. I'm the center manager here at Azalea Health in Crescent City. I've been here for 11 years and I'm still going until retirement. What impedes? Impedes our community is the poverty level is dangerously high. It allows for preteen pregnancy, unwanted pregnancy. Most time, no care because of it. So that's one impede. The second one is that no insurance, and that's a suffering consequence for people that don't have insurance. They really don't know where to go. So with us being in this community, our objective is to make sure that we reach out to the community to let them know that we offer a program for that, and we offer a sliding scale for people who does not carry medical insurance to get care that they need and to keep them healthy and alive from birth to death. The sliding scale is used when we have a client, patient, that does not have insurance for one, that is below the poverty level, and it's different slides. There's income verification. We have to do that in order for it to carry over until the patient can get a discount cost for medical care. And I think it works. There's different sliding scales that go. The highest one is D, and the lowest one is A. So most of our clients, patients, fall into the sliding A scale because, as I say again, it's a poverty-stricken area that we're in, and we are known as that rural health care center. Yes. There are offices in my system here that we do diabetic teaching, we do high blood pressure teaching, what to not do, what to do to take care of yourself. But unfortunately, there's how can I say, can be hard because some people don't want to attend because they can't get there to that place that we offer. When they come to see us, we offer the education here as far as we hand out leaflets, we do nurse teaching, patient teaching. But in all reality, you must know that humans will do what humans don't want to do sometimes, and what they do. So it's out there, we offer, and it's up to the patient to accept. Most times the physician, it's most times when they find it, it's when the patient comes really sick. Sometimes we just had the patient to come, oh, I just need to be checked for, I need my medicine for my blood pressure. Hadn't had blood work, hadn't had a physical, hadn't had anything checked in many years. So that's more than likely how they would find that they have a problem, and we address it at that time. So most times the physician finds it. We offer health fairs. We do that for our community, maybe twice a year, if the weather would permit us to do it on that day. Then again, there's outreach for migrant. So if they can't make it here, they have health fair there too, where they can be reached. Also, there's the St. Vincent bus that's there in town, park every Thursday there at the Winn-Dixie. So if you can't get to me, you can get to them. We have that outreach and as well the St. Vincent bus. And also there's a Rotary Club that does blood testing occasionally. And I think it's most times where they go if they don't want to come to a doctor's office to do it. Educate, educate, educate. Educate. From birth to death is where we are here. And it's the primary source of what we treat here. But again, I will say that it's up to you. How do you want to proceed and take care of yourself for the rest of your life? We do blood pressure screening, we do diabetes screening, all of the nice little things. We hand out information. We let them know that there's HIV screening, and that can be done very quickly, without a doubt. So the health fair, it plays a big part on the community because some people cannot get to the doctor during the week. So with us holding them on weekends, which this one will be, we will hope that there will be a good turnout, and we give out information where we're located and that they're welcome to come to us for their care for those issues. Not only those, but the main chronics.
Do you think that there is like a mistrust between the patients and the providers? Like the patients don't trust the providers because they think that either the providers just want money or don't really care about them or whatever their reasons.
I can say that that can be true probably about 40% of my patients. Because once you go to the doctor, you already, how can I say, there's a anxiety. When, I'm going to the doctor and I know I'm going to get in trouble because I haven't seen a doctor. But once you've seen your doctor maybe after 1 or 2 times, then you should develop a rapport with your doctor and be able to speak to him or her about any issue that's regarding your health. And sometimes we get it where we don't even do health. There's mental health too. So it's a broad spectrum. And again, I will say, it's how you present yourself to your patients and how you would approach them. So I can say that can happen. That would be untrue to tell you no. You're dealing with a population. Some of them hardly ever finish high school. Some of them rarely go to college. So it's a problem.
So you can explain the physiology of the heart to them, but doesn't mean they're going to understand.
But they won't. Sometimes you would draw pictures because most times that's what they would look at better than you would explain to them. And that's just the level that we are living in this area now. I'm sure we're not the only ones, but this is where we are with that.
Do you have any final words?
Yes, I do. I would love to see that although we are receiving education, giving out education and doing all of the nice little things that we can do to process the patient, I would like to see that our government would look to our doctors and their nurses and not to make it more difficult for them to take care of their patients by, we could say, so many things to do before you can even care for your patient. And it's unfortunate that we're living like that in this country, but we have great doctors, great nurses. Without them, we would not have a society that would stay as healthy as it is. So, in that final thought, I would think that I would love to see our government make it less difficult for the doctor and the nurses to work together and take care of the patient, people in general, without impede.